Hello to all MRCG candidates who are taking part 3 or even part 2. We thought we can start some teaching sessions and we can record some videos on most common topics to help candidates to be familiar with the system which works here in UK. So I'm going to give a little introduction of myself so that you guys can know about who I am and what I have been doing and what is my relevance to be involved in these teaching sessions for you guys. So my name is Dr. Jabeen and I'm obstetrician and gynecologist. I have been working in NHS Obs and Gynae in UK since 2003. I will be going through shortly a bit of background. I was initially trained in Pakistan. So I did my initial education in Rawalpindi area, and luckily I have been really a very good student, bright students, taking positions and scholarships. Then I did my medical degree from Fatma Jinnah Medical College, which was in Lahore, and my house job was in Gangaram Hospital, Lahore, for 1 year, which was in Obs and Gynae. And then I worked for 1 year in one of the rural health centers in Murray, which was mandatory at that stage for all the new trainees. And then I did 2 years of my postgraduate training in Obs and Gynae in Holy Family Hospital, along with Professor Dr. Rizwana Chaudhary, who was my supervisor at that stage. Then I moved to this country and I started my job in Cambridge University Hospital. I worked over there, and then because my husband and my family got settled up here in North, so I was moved into Mid Yorkshire NHS Trust. Now, while working in this country, I was not only working as a clinician, I did have a lot of ambition for medical education and also to minimize the discrimination, you can say, or you can say the difference in the quality of care being received by the patients coming up from different ethnic backgrounds and different cultural and faith-based backgrounds. And because I had worked in Pakistan and then when I came over and worked over here, the experience of working and exposure to the people at both places, back in Pakistan, one of those developing countries where there are limited resources and the problems and the issues are a lot more complex related to the health as compared to this country. The awareness level of the people and obviously the facilities and the standard of the care provided is quite different in both areas as well. So having that experience from back home and then having experience of working in this country did put me in a very unique position where actually I could understand the difference and also can suggest and look into the issues. How can I help the patients to receive good quality of care, and also work for my own trust and an organization to ensure that we are actually providing high quality of care to all of our service users, irrespective of which background they are coming. I got involved a lot into the development of the clinical services and the improvement, and also was directly involved working with the patients, with the different patient representatives and the forums to try to help understand their problems, which could be a language barrier, their level of understanding, to understand how we can actually improve our services and pathways which we can adopt actually to help them. So I got involved in that one quite a lot. Then I always had a big ambition for teaching. So that was another area. I have worked a lot in this country. I have been trained in medical education, and I'm clinical tutor and I'm lecturer and certified OSCE trainer and examiner for Leeds medical students. And obviously, in this country, we are involved in active education and training in the clinical training. of the medical students and the junior doctors. So I do work a lot on medical education as well, not only directly clinical education, but also on the communication skills, improvement of communication skills, and work under stress, conflict resolution, and working with difficult patients and the colleagues. I also run training sessions for our junior doctors and even for our consultants, um, just to have them to understand they are mandatory part of training in this country for all the medical practitioners and all the medical staff really. So this is a bit about these studies and the medical education. So because of my that work, I have been awarded multiple national and regional awards in almost all the domains we have talked over here, starting from the development of the clinical services to enable my trust to achieve the highest standards of clinical care we are providing. So we were given national award for the sexual health service project of the year. Then I have been given one of very prestigious national awards, that's called Brooks National Award, and that was also to be actively involved in patient care and meeting the needs of the patients according to their high expectations. I was also given Medipex Innovation Award, and that was to develop the particular sexual health services for all of our women coming from different backgrounds, especially the patients coming from hard cultural backgrounds where there are many lot of taboos associated to access the gynecological and the sexual health services and the contraception services for the women. So these are few of my those awards. I was also given this award of Doctor of the Year. I have actually been awarded this award quite a few times, and that was the very good thing about this award is that in this for this award you get nominated by your patients. So this award is run by one of our national newspapers. So what they do, they just advertise in that local area, asking for the people to nominate some healthcare practitioner of their area, which they have been satisfied from the standard of care provided by that. So I have been few times actually nominated by my patients, and have been lucky to win that award for my region of Yorkshire. And that itself is actually a reflection, that my communication and my care with the patients have been very sensitive and up to the high standards and mark. I was also given National NHS Patient Champion Award, and that's quite prestigious and one of the top awards in this country. Um, and again, this was the nomination by the patients, and then I was the winner. Another award I was given was given by this Mary Claire organization, and this award was called Woman at the Top Award. So these are given to top 10 women from all over the UK who are thought to be inspirational innovators or the inspirational women. So I was lucky one to achieve that award as well. These are few other awards as well, and obviously when you become so well known and popular, then you get interviewed by different newspapers and by news channels from radio and TV. So I have been quite commonly on different radio and TV health associated programs as well. So there's some other award. As a team lead, I won the whole team. So this is a summary. I just thought I put that one in as well, just for the people who will be accessing our these resources of learning. Obviously, you need to know about us, and you need to have faith and trust in us as well. Um, on a lighter note, to get more further details and the verification about my skills and qualities, you can actually simple Google me. So if you actually put in Google search, you put Dr. Safia Jabeen, you will be able to get almost 2 pages of Google search showing up my different awards and achievements. So that's about my initial introduction. Now coming to the more relevant topic, why I decided to put this free resource of teaching for all the trainees in obs and gynae, especially from overseas. Um, I was last year contacted by Professor Dr. Chaudhary, who is head of Department Gynae Unit 1 in Holy Family Hospital, Rawalpindi, who has been my respectable trainer and supervisor when I was doing my 2 years post-graduation training in Holy Family Hospital. So obviously she has been aware of all that work I have been doing in this country, about the patients, development of services, and also in medical education and training and examination of our students and medical doctors. So she asked me to help the candidates who are taking MRCG Part 3 from Pakistan, as because of again the same difference as we have not only for our patients across both ends of the world, it's also for the doctors as well. Because they're working in different culture environments and under different level of resources, it can be quite difficult for people who are working outside UK to understand the health services and the standards of care and the ways of communication in this country. So I started doing some coaching from last year, and just about 1 year this month. I have trained quite few people. We didn't advertise our course quite much because I was just too busy to do it on a wider scale. So I have been going in small groups, and luckily I was able to help them to pass their exams. So we do have 100% pass rate in last 2 exams. Well, we coached only for 3 exams anyway till now. And what I was able to understand in 1 year of this coaching to these small group of people, that they're having quite a lot of problem to understand the exam style, and also again the difference in communication between the patients and the colleagues. Um, I am aware there are few courses out there, and the people are trying to help these overseas candidates to understand the system and the examination format which works in this country. But unfortunately, most of them are also based outside UK, and they're working outside UK, or they have only briefly worked in UK, and they're providing these courses from their own resources when they did MRCOG, and from their understanding of the system of their in this country. So as a result, because it was difficult for them as well, and it was quite different and kind of an alien situation to deal with, particularly MRCG Part 3 in these countries. As a result, the way they are coaching, it has become, and the picture given to the candidates and to the trainees is that MRCG 3 is a very difficult exam. And it's really kind of an alien world you need to go to, and you have to adopt and become quite different to do these stations, and you have to behave in certain manners. Contrary to that, MRCG Part 3 actually is the most easiest part of the MRCG exam. And the Part 1 and Part 2 really are the examinations, because that assess your clinical knowledge. Part 3 is basically not really about checking your cleverness in the clinical knowledge, which obviously has been checked in first 2 parts, and we are confident that you have acquired appropriate clinical knowledge, which should be expected from one ST5 trainee. This exam is more to assess that these trainees who are working as ST5 level, and after further 2 years of training, they will be actually working as consultants. So are actually they able to understand the systems, and also the elements of safety, their communication, their empathy skills, um, and how the NHS work. Do they understand those, and they are able to, they are safe enough to go ahead and perform as consultants in a couple of years time. So I usually say this examination actually is very easy examination, but yes, it is difficult for overseas candidates because the local UK culture and the communication with the patients, and the priorities of the patients here, and then different systems and processes like related to effectiveness and the safety assurance, like audit and risk management, and all these are obviously different and probably new things for those candidates. So that probably is the problem where most of these candidates are struggling. So for that reason, I have decided not to start this regular program of teaching. It will be free of cost. I'm not sure, my admin team is probably going to start some YouTube channel to broadcast these regular sessions, and so that will be shared later on with you guys on Telegram group, so that you all can access and pass it to your other colleagues as well. This will be equally good for part 2 or even part 1 candidates, so that right from the beginning you can understand the systems and the way we manage patients over here. So please do subscribe their channel once we have given you the details, so that you can access and you can get the alerts about overall teaching sessions. The first session, which will be uploaded soon, is on clinical audit, because that's my other area of quite interest and my expertise. I am clinical governance and clinical audit lead for my unit. So for same reason, obviously I do love to explain and teach and audit. And I'm pretty sure once you have, you will actually attend that session or go through that session, you will be able to, the audit will become very easy for you to understand, and also to critically appraise how we critically appraise the audit. So that will be our next video or the session, which will be coming up very soon. Any questions and any queries and any particular topics you guys would like me to record and teach for you people, you will be able to leave those messages on the Telegram group which we have started, and that is called MRCG Overseas UK based trainer Dr. Safia. I think that's the ID of that group. So please do join that group to stay updated, and we will be sharing all the details of our upcoming free sessions on that channel. So that's all from me today, and as I said, wait for our session, teaching session on clinical audit, which will be coming very soon, because November exam is approaching, and we want people to be clear on certain aspects of the clinical practice, and the patient safety and the communication, which is checked in the examination. Thank you and goodbye.